Hello, welcome to the special edition of 1036 on Milwaukee PBS, Lead and Our Health, a follow-up. I'm Portia Young. It's been a year since 1036 first took an in-depth look at the effects of lead and our health, lead primarily from paint, water, and soil.
Let's just say this, there's no acceptable level of lead for the human body, so just at that very ground floor level, lead is not good. But this is perhaps one of the biggest modern day public health crises that we're facing here in our city, in our state, in this nation.
It's a public health issue that has not gone away, and it's one that impacts the lives of thousands of children and families in Milwaukee and some of our older suburbs.
I wasn't here when this house was built. I didn't make the decisions to use lead, So now you're telling me that my house, because of its age, is potentially having issues with lead. Help me do something.
So we wanted to find out what has changed in a year and what individuals and families still need to know about keeping safe and healthy. This time we have gathered an audience here at St. Anthony's School at 9th and Mitchell on Milwaukee's South Side. This is an area of the city with a high density of lead due to an older housing stock and lead water laterals. In the next hour, we will tell you about critical lead hazards, primarily in water, paint, and soil, what you can do to prevent or lessen lead poisoning, including the use of a water filter. We'll talk with health professionals about the impact lead has had on our children in particular, and the importance of lead-level blood testing. We'll also hear from city leaders and those advocating for quicker solutions to lead abatement. And we will hear from our audience members here at St. Anthony's. Joining me right now is Susan Bentz, environmental reporter for WUWM Milwaukee's NPR. Now, Susan, welcome. Thank you for being here.
Thank you.
And I know you have covered this extensively for WUWM and 89.7 FM. This past year, you've done this for 1036 as well here on Milwaukee PBS. What has happened in the past year since we last spoke, Susan?
We're about to look at that, but there's been many developments. At the same time, we're hearing from a lot of people who are confused, who don't know what steps to take. So it's important to look at the last year. It's a lot to take in, but so it's important to hear it.
Okay.
A lot has happened since Milwaukee PBS hosted its live Lead and Our Health special a year ago.
When families come into your office, to your examining room with children looking for advice and identifying problems, what do you need to know?
The most important thing is to have those regular checkups with your provider. As part of the normal evaluation process, you're going to get some lead levels checked at the very early age, before age 3.
During the program, then Health Commissioner Bevan Baker said preventing disease before it happens is the cornerstone of public health. As for the threat presented by lead, Baker said,
This is a public health crisis of our lifetime. We have to make the investments now to get the return on investment for the future of the city, future of the state and the nation. This is a concern.
The number 70,000 is etched in some people's brains. At least that many families in the city of Milwaukee alone have lead pipes that carry city water from the main into their homes. Baker said replacing each and every lead line would cost hundreds of millions of dollars and require decades to achieve. But he said installing new pipes at daycares was a top priority.
We want to focus on babies. We're focused on daycares and child care centers. Get those pipes out first, because lead can be most destructive to the smallest of us.
Money was available to tackle all 350-plus early childhood centers. Yet, despite Baker's resolve and the necessary dollars, in 2017, crews completed 144 of those daycares. As of April 6th this year, a total of 163 have been replaced.
Lead is a natural element found in the Earth's crust.
All the while, some people worried the city of Milwaukee wasn't doing enough. Where was its master plan to replace all lead service lines? Where were additional filters for those at highest risk? The health department's public health awareness campaign called Lead Safe Milwaukee raised criticism. while it folds in 3 major sources of potential contamination: water, soil, and paint.
Peeling and chipping lead paint is the #1 source of lead poisoning in young children.
Critics say the campaign put too much focus on lead-based paint and little on other risks. While she headed the Black Health Coalition of Wisconsin, Dr. Patricia McManus said it was time for the health department to broaden the public health awareness campaign.
I do fault, not fault Bevan, but maybe I do, because it always comes back to the lead and the paint. We've done such a great job. We're known in the country for doing the best, and well, that's great, but what about this other stuff over here?
At the Common Council level, Alderman Tony Zielinski pushed hard to pass an ordinance directing the health department to emphasize that when it comes to lead in water, installing filters is the best defense.
Whenever the health department mentions flushing water, they should mention it in conjunction with water filtration, so that the public doesn't get the idea if they flush the water that's adequate.
We have recommended the use of water filters. It's almost as if I don't understand what others are not hearing. Not only have we recommended the use of water filters, we've distributed thousands of water filters.
In the end, it would be the health department's lead program that brought Health Commissioner Baker's downfall. Earlier this year, Mayor Tom Barrett said he learned that over several years, the health department failed to notify families of at least 1,500 children who tested high for blood lead levels.
That was, again, something that alarmed me, and I would think would alarm all of you.
Health Commissioner Bevan Baker promptly resigned. In swift succession, the Common Council voted in interim commissioner, Dr. Patricia McManus, who was not Mayor Barrett's choice.
And I knew I had the expertise for the job, and that's why I agreed to do it.
Soon after, the primary funder of Milwaukee's lead paint outreach program, HUD, the Department of Housing and Urban Development, issued a stop order until the health department sorted out its muddle, and it appears to be a murky muddle. Just days ago, news broke that the person who had managed the city's childhood lead program for the last 9 years, Lisa Lean, has been suspended after a report found her performance incompetent.
Here's an opportunity to put a citywide plan together.
Congresswoman Gwen Moore, who represents Wisconsin's 4th District, says she's observed a lot of finger-pointing. She thinks Milwaukee could create more than lead-free environments.
We have fantastic agency with the building trades and others where they could really train people to do lead mitigation. Maybe we could come up with sort of a kind of a works program so that we can deal with the limited financial resources that we have.
So stepping outside the drama swirling around City Hall, are residents better informed about how to protect their families from lead contamination?
If it's made out of lead or copper, the portion from the main to the curb stop, that's the city-owned side, and from the curb stop to the water meter, that is the private side, so that's the property owner's side.
16th Street Community Healthcare Centers doesn't think so. It held several workshops in March and April to provide people with hands-on information about steps they can take to protect their families from lead in paint, soil, and water.
The first thing we recommend is to use a water filter. That's the most guaranteed way for you to reduce your exposure to lead in drinking water.
River West resident Carol Hayes runs her water every morning when she gets up, but she'd like to be much better informed. Carol doesn't expect the city to replace each and every lead lateral quickly, but does think it should arm residents with clear, practical information to protect their families. Her assessment of the city's performance?
Kind of bumbling. It's like, okay, if there's a problem, tell me what to do. I shouldn't have to spend tons of time sleuthing out the answers.
Carol decided to give local government another chance. She navigated the city's homepage and found the Milwaukee Water Works. She didn't readily spot information about lead, so she called customer service.
Good afternoon, Milwaukee Water Works. How can I help you?
Carol learned she's on the replacement list.
It may be a few years before they get to everybody.
She asked about a water filter that was installed in her home before she moved in.
I have a whole house water filter. Are there filters that will do the whole house?
I want to say no.
Carol finished her lengthy chats feeling better about Milwaukee's public health performance.
It sounds like if you can get to the right website, there's information available.
So there's a lot of people, we think, who feel as Carol do, people who are watching at home.
Yeah, and probably many people right here in our audience.
So could we have a show of hands for any of you who don't feel you understand the issue or don't know what steps to take for your own family? Any hands? We're hoping that, with the information today, there are many more of you who will feel better informed.
Right, and that's the point of our follow-up today right here on Lead on Our Health. So we double-checked, Susan, with the Milwaukee Health Department, and they tell us if you still have questions, please use the Lead Information Hotline. It's 414-286-8800. That's 414-286-8800. You can also use the website, leadsafemke.com. So if you live in Milwaukee, you can go there, look up your address, and find out if you have lead service lines. Now, suburban residents will still have to contact their local city hall. So let's meet our first group of panelists who will focus on health aspects of lead. Dr. Heather Parody, pediatrician at Children's Hospital of Wisconsin. Good morning. Gavin Engstrom, Director of Environmental Health at the 16th Street Community Health Centers. Welcome.
Thank you.
And Helen Meyer from UWM Zilber School of Public Health. Thank you for being here with us.
My pleasure.
So we do want to point out that Milwaukee's interim health commissioner, Pat McManus, was unable to join us as a panelist, and the health department said that no one was available to take her place. We also extended invitations to Milwaukee Mayor Tom Barrett and Milwaukee Waterworks, the city's water utility, and they too said they could not participate. So we will hear from our panelists in just a few minutes, but we do want everyone to first listen to this next story about a family frustrated about their young child's lead poisoning situation.
Filtering water is a necessity for this Milwaukee family.
We know lead is a poison, so there is no safe level. No matter what someone may like to see, you want to see it as low as possible. But 11 is pretty high and begins to affect your bones and your brains, especially for children that are very young. So we got shocked with that and dug our teeth into it right away.
Nathir and Amina Al-Mujahid have 7 children. Schweib is their youngest son and the only child who has an elevated lead level.
Our oldest is in college. Our second oldest is also in college. So they're not in the home right now. And there are remaining 5 here, and 2 are in high school, 2 middle school, and Schweib just runs the roost.
The family believes it's a result of drinking the water in the home that they moved into 4 years ago.
From what I see, lead, can be in the paint, it could be in the water, it could be in the soil. He's not out eating dirt, you know what I'm saying? Mm-hmm. So it has to be the water. And when we moved here, we didn't have the filters because of the faucets, the way the faucets are set up that we had at our previous home. So we were drinking basically kind of from the tap and thinking it was okay for a while and so on until we got those results.
In the 4 years he's been tested, his level has been as low as 3.7 and as high as 11.4. In January of this year, he tested at 5.0. That's the level that the Centers for Disease Control currently considers high.
The very first thing we were trying to do was trying to get whatever lead out of the system. So we had to study, try to find out how to detox things. Sad thing is lead is real tricky. So even after 30 days, it may not necessarily come out your system, even though it'll read lower, but it's went into your different organs, especially your brain. Mm-hmm. So we tried, we're doing and continue to do with vitamin C, I think is activated charcoal, calcium, magnesium. So there's a number of different natural things we're trying to do to kind of get these metals out of the body.
According to the Centers for Disease Control, lead poisoning can be harmful to brain development and the nervous system in young children. The family believes it may be impeding their young son.
We notice his development has been slower than our other 6 children. Mm-hmm. So normally our children would start speaking about 2.5 to 3 years old, holding conversations back and forth. We can say, how old are you? They'll say 2 or 3 and so on, just the traditional stuff. But we weren't seeing this in him, especially, so his speech was pretty delayed. And so I began noticing, my wife and I began discussing it, talking about it, talking to the pediatrician and so on. And this is, again, around the time when we came across Flack's information about lead and looking at results of children that are affected with lead. And he began to exhibit those behaviors, or at least we had become aware he was exhibiting those behaviors. He could have been exhibiting them prior to, but our knowledge, you know, saying it looks kind of line in step with those who are affected by it. So we just been loving him to death, being more patient and stuff with him. It's not his fault. So, but we know that he's not at the level of a child that he can go on, you know, K4 or go in kindergarten right now.
For us, we've had to learn and do our research so that we can help our son learn as best that he can. And I really didn't know how to do that, but we did our research and tried to figure out what fits or suits him right now, mentally, physically. So it's kind of turned things upside down in that way. But for us as his parents, it's an honor for us to do that. But it's unfortunate that we've been put in a position to do so. He's really the one that is suffering from this.
So we have constantly heard that lead in paint is the primary source for lead poisoning in children, but this family is convinced that it was lead in water that affected their son. So we do want to get some brief reactions from our panelists to this family's situation, and we'll start with Dr. Parody. So your reaction to what they're saying, that lead in the water is what affected their son. How can you react to that?
Well, certainly the child in this case is not a patient of mine, and not anyone that I knew until right now. To the family's credit, it sounds like they had enough of a concern and really wise professional guidance that they did do testing of the blood, which is really our professional advice for parents of young children, is that they should be routinely testing the blood. In fact, we try to follow the guidance from the state and the city of Milwaukee around this issue and really strive for 3 blood tests by the age of 3 for all young children.
Can you help us understand the different levels of lead within the blood at different points in time? What accounts for that?
So as I say, we encourage blood lead testing usually around age 1 for most children. And quite often children will first be done by a finger prick test, either in their physician's office or maybe at WIC or another early childhood setting. If that level comes back elevated, so a 5 or higher, they will oftentimes be recommended for a venous test or a blood draw from their vein, just to confirm that level.
Okay. So how do you pinpoint the exact source of lead? That's the difficult part, right?
So oftentimes, depending on what the actual blood level is when a venous draw is done, that will trigger a series of events. So from the medical field, there will sometimes be some follow-up questions and studies that may be recommended. And quite often, getting to the true source involves not only medical investigation, but also environmental as well.
So Kevin, in the last year at 16th Street Community Health Centers, have you seen more or fewer children with blood issues?
We're seeing a plateau of our prevalence rate. So we're, over the last 5 years or so, we're seeing about the same numbers of tests that we're conducting. In last year, 16th Street conducted over 8,000 blood lead tests, and that prevalence rate is fairly standard, or fairly flat.
Okay. Dr. Meyer, could you weigh in on this really complex issue? When we see this risk in paint, and they're still saying paint, but there is lead that we know is present in the water.
Absolutely. There are multiple sources of lead that our children are exposed to. However, not all sources contribute equally to childhood lead poisoning. And so at the national level, at the state of Wisconsin level, and here in Milwaukee, lead paint is still the #1 driver of elevated blood lead levels in our children. That's not to say that other sources of lead are not important and don't deserve attention, but what it does mean is that parents and the community need to be aware of the hazard that lead paint in homes pose to their children, and the community needs to be educated on the ways that they can abate or prevent exposure through that means. And again, this is not to say that other sources of lead aren't important. However, that is what the data shows.
So we're hoping to take questions soon from the audience, but Portia, I think you have one right now.
Yes, we did have one from Kathy, and she's in the audience. She submitted a question. She said that she flushes her water in the morning for 1 minute, but then what's the standard? Should she be doing it for longer, 3 minutes? Who would like to address that?
Our recommendation to families that are in our lead outreach program is to use a filter. And so I think in looking at the data on flushing tap water, there's a lot of inconsistency with the levels as they come out. It's not a straight linear decline. And so using a lead certified filter is our recommendation.
Okay, so flushing would not be enough.
If for no other reason than the waste of fresh water and just the inappropriate use of massive amounts of fresh water going down the drain. So a lead filter is our recommended solution.
Okay. Well, we are going to stay with lead in the water right now. So how do you even know that lead pipes even exist inside your home? Let's take a look.
You probably get a drink and never think about how the water makes its way into your glass. But Jessie Canizaro does. Not only does she own this rental home in Wauwatosa near 63rd and Meineke, she is a master plumber.
I'll be honest, I have a lead service in my home. I don't plan on replacing that in the immediate future, but I will say it is something I've been thinking a lot about, and I know that it will need to be replaced.
If your home was built before 1950, there's a good chance you have a lead service line bringing water to your home. To know for sure, if you live in the city of Milwaukee, there's a website where you can type in your address to find out about your water service.
Most homeowners will look at me and they'll go, what is that? So they don't know what it is, they don't know what it looks like, and if they do know where it is, more often than not, they don't know what all of the different components of it are.
Time to be educated.
The easiest thing to identify and find is going to be the water meter, which is usually going to be black in color. Sometimes they're a different color. It may not be quite as bulky, but if a homeowner can find where this is located, they'll be able to figure out where their service is. From the street to this point is called the water service. From this point into the house, we technically call it water distribution piping. What you're going to look for is a pipe that goes underground. It's not going up the way this pipe is. This goes underground, travels out to the street. Looking at this grayish color, there's some nicks inside of it, paint on it for many, many years. You see this grayish color though, this is lead. It's not going to be a copper color like a copper pipe, that's going to be a gray.
If you're still not sure if you have lead pipes, zero in on the valve, usually to the left of the water meter.
This is the number one tell. When you see this older style of shutoff that's got this little slot, this style of valve prone to leaking, you'll actually see there's a little bit of white on the ground there from where it's leaking and some of the minerals have been left behind. And just touching gently on the bottom of this pipe, I've got a little bit of water there.
The other tell you have a lead service pipe is this bulb shape before the valve.
It's 80 to 100 years old in this home, and it's going to likely be an issue.
Which means if the valve breaks or the service pipe bursts, then you'll have to pay for new pipes.
This is what we call poly PE, you'll call it HDPE. It's a different type of plastic tubing. It's not always going to be blue. Sometimes you're going to see it in black. We don't see this inside of the Milwaukee area. Milwaukee actually prefers to have copper run into homes, so you're not going to see this as often, but we do see it out in the western Waukesha areas. It's very, very typical.
And means there's no lead. Plus, to make it easy to tell if a home has new plumbing, look for the letters NL stamped on the valve.
That's how we tell that this fitting has been made. There's no lead inside of it. It stands for no lead.
But let's say nothing's gone wrong with your lead pipes and you don't need to replace them yet. You have some options to make sure your drinking water is safe.
Some very good information there, Susan.
Absolutely, and people are also asking about how they can get their own water tested at home, and also whether and how they get a hold of a water filter. So we'll look at that story.
The samples come in containers like this.
Usually we'll have a number and the address.
An accurate scientific test for lead in water takes time, a long time.
And you were counting that time when lab receives the sample. So not counting like the collection time and how long it may take for the lab. It's minimum 72 hours.
Laboratory Director Sanjeev Bhattacharya stressed that the tests run by the Milwaukee Health Department are strictly quality controlled. Rebecca Panakos is one of the chemists in the lab. She gave us a very condensed step-by-step tour of the water testing process.
This is about a liter of sample. So the first step to get the lead to be all in the same form that we're going to analyze is that we do an acid digestion, which basically means we add some acid to our sample. In this case, it's going to be nitric acid. What we're trying to do is make a 1% volume per volume nitric acid solution. And what this is going to do is overnight digest and decompose anything that's in there into the form of lead that we can find, if there's lead in there. So our next step is going to test the pH after it's been digested for 16 hours.
So the acidic solution shows that the lead you're looking for is in there, or could be in there.
No, the acidic solution allows that if any lead were in there, it would be in the form that we can detect. And it obviously is 1. So now we can go on to our next step.
To our eyes, water is clear. But to accurately test for lead in water, the lab has to make sure all the little particles are removed.
And so turbidity is the measurement of clarity in the sample. Most water samples are going to have small particulates that you can't see at the naked eye.
This sample checks out. Then it's on to the test that looks inside the water sample using a special 3-step light. The reflection of lead in the sample sends out a signal that's calculated by the computer.
The more lead there is in the sample, the more there is a change in signal. So the signal is proportional to the concentration of lead in the sample, and we use that signal to determine how much lead would be. Now you can see the sample being dispensed onto the cuvette. And so that's about 20 microliters. It's a very small amount of solution. This sample had very little lead in it.
A Milwaukee resident can't just walk into the health department with a bottle of water for testing, but you can call the city Environmental and Disease Control Department for a specialist who can determine if your situation qualifies. Jean Schultz is the specialist. She goes to daycare centers and people's homes to gather water samples for testing.
So in the sampling test kit, we usually have our bottles labeled 1 through 4. The homeowner or tenant collects the water samples. They collect 4 bottles. We provide them instructions in English and in Spanish, and then I also instruct them on how to fill out our chain of custody form.
The people at the child care centers, they can do this process?
Yep, I've had any issues with anybody not being able to take the samples. It's pretty simple instructions. They just need to let the water sit in their plumbing and follow the instructions and just turn on that cold water tap at the kitchen.
What if somebody has a home lead testing kit?
Those are not sensitive enough, and you may get some false information or false positive results that may create some concern.
Tests like this one are available at hardware stores. They're expensive, but they are not as specific as the health department.
Ideally, there is really no safe level because you want to see the least lead exposure that your kids can have.
And whether the water in your system has been tested or not, the health department says there is one big thing you can do to clear your water. Get a filter system and hook it up to your tap.
And if you change the lead laterals, and then we find out that some people could have lead in their plumbing still inside the house, it's one of the reasons why we really encourage people to use the filters, because if you get a lead lateral changed, if you got lead in your plumbing, it's still a problem.
Health Commissioner Pat McManus.
So the filters are the biggest thing we really try to push.
And take note, when shopping for a water filter, look for the National Sanitation Foundation code NSF 53 to be sure it filters out lead.
So, Susan, you did find out some interesting efforts that Milwaukee City Waterworks is doing. What are they trying to do?
They're setting up a lab that will be accredited to test people's water, but it's a long process, we were told. It has to be approved by both state and the EPA. But we were told that when it's set up, they could handle a lot of testing, and it's quite quick.
All right. Thank you, Susan. And right now, we do want to mention that our studio audience here, we are going to be distributing water filters to families in our audience here at St. Anthony's to help with lead poisoning prevention. So we want to thank the United Way of Greater Milwaukee and Waukesha County in partnership with A.O. Smith and Aquasana for this very generous donation. It's time now to hear more from our audience members here at St. Anthony's at 9th and Mitchell in Milwaukee. Susan Bentz from our partners at WUWM, Milwaukee's NPR, and Jabril Faraj from our partners at Milwaukee Neighborhood News Service. They're standing by to help with that. Now, we can only take a few questions, so we do want to get started right now. Susan and Jabril?
Hello, my name is Nazir Al-Mujahid from Milwaukee. I heard one of the doctors state that when levels are at 5.0 or above, that there are certain questions that are asked or studies that are suggested, as well as environmental studies. And I've been working with my pediatrician for a long time and had different questions asked, but I never received any specific studies, medical studies or environmental studies suggested. So I would like to know with more specificity, what types of studies would you suggest in children who have high lead levels?
Sure. So quite oftentimes when we are testing for lead, we will also be testing for anemia, so either a hemoglobin or a hematocrit level, because we know that the combination of elevated lead and anemia is a particularly dangerous one for young children.
Dr. Myers?
So I just want to be sure that I understand your question correctly. Were you asking about like specific research studies that have been done, or more additional tests that should be done on the children?
Well, she had initially stated there would be more questions and more medical studies in addition to environmental studies, because it sounded like there was a lady was speaking saying, you know, authoritatively speaking, this is coming from paint, but how do we know it's actually coming from paint if the water isn't being tested? So how can we really say what the number one cause is, let alone what to do at that point? So my son has high lead levels. What would you suggest now? What's the next step?
Absolutely, and I just want to thank you for being here, and I completely understand your concern. I also have a young child, and I know that as parents we want to do everything possible to protect their health. And so your pediatrician or the primary care provider that you see with your child should be asking you questions about what kind of house you live in. So if your house was built before 1950, or 1978, which are important dates in terms of when lead service lines were used, as well as when lead paint was in the house. And then there might be additional questions, and maybe Dr. Parody can also speak to this as well in terms of, has anyone else in your family tested with elevated blood lead levels? And this is really meant to assess the risk factors that you on the individual level that are present in your home and in your environment. And then based on that, they might recommend, screening at year 1 and then 3 under 3, right? So screening at age 1, age 2, and age 3. So we actually see that most children test positive for elevated blood lead levels, so above that 5 cutoff, around the 18-month age. And so, this is the newly mobile, curious toddlers, the hand-to-mouth activity, and so that's definitely an important time point to be testing for lead, as well as having conversations with the doctor or your physician about your risk on the individual level in your home.
Thank you. Well, in March, we heard from one of the leading experts on lead. She spoke at Marquette University. Her name is Dr. Yana Lambrinadu from Virginia Tech, and she praised Milwaukee's grassroots efforts in the fight against lead. Take a listen.
As frustrated as you all may feel about what's happening here. You know, I've been watching from the outside, and I have to say that you've made more strides already than most of us, and most of us, even including Washington, D.C., that has been dealing with this issue since 2004. And so that you really have what it takes. You have an incredibly powerful coalition that many of us would love to have. And we're watching you, and a lot of us on the outside are here to support you any way we can. You are really at the forefront of this fight right now, I think, nationally.
We have 4 such advocates with us now, and they've been on the front lines fighting for those impacted by lead hazards in our city. They are Robert Miranda, spokesperson for the Freshwater for Life Action Coalition, Sherry Tussler, executive director of the Hunger Task Force, Brenda Coley, co-executive director of the Milwaukee Water Commons, and Alderman Tony Zielinski from the 14th District, which includes Bayview. Jabril Faraj from our partners at Milwaukee Neighborhood News Service has covered the lead issue extensively, and he will lead this panel discussion. Jabril?
Thank you all for being here. Sherry, we've heard about the impact that lead can have on children, but I recently spoke with a doctor at the Medical College of Wisconsin who reiterated that it can also have effects on adults, that it can contribute to depression, kidney disease, hypertension, and late life illnesses such as Alzheimer's disease. Can you briefly tell us about your personal experience with lead and why it's an issue that you've chosen to advocate on?
Sure. Like most other people, I tested my water, and I found that I had lead in my water, so I decided I'd get a blood test. And I found out last year that my blood lead level was elevated. The first one came back at 11. The second one came back at 17, which was pretty scary. But the good news is I'm back to 7 right now, so I am lead poisoned.
And so why is it, why has this been important for you to get involved in on a personal level?
Well, on a personal level, I just think it's important that women of childbearing age understand that they themselves can be lead poisoned, and as a result, it could impact the health or well-being of their fetus. And I think that kids should grow up to be healthy, so I want moms to know that they should also be healthy if they're considering pregnancy.
Robert, FLAC has been at the forefront of educating people about lead service lines, which can contaminate otherwise clean water. Since 2016, your group has been advocating for the city to replace those lines at no immediate cost to homeowners, claiming that the city is responsible because it mandated the use of lead service pipes for decades and allowed lead to be used in exterior plumbing until 1962, when it was banned. How has the city responded to your efforts?
The city has been responding in the way the city has responded to a lot of major issues: confused, unsure, and not willing to tackle the real political agenda of the community. The mayor has been absent, and the bureaucracy of the city is running roughshod. Our research has shown that since 1872, this city has been mandating the use of lead. As a matter of fact, in 1921, the Common Council passed a resolution calling for lead laterals to be made of extra strong lead. It wasn't until 1952 that they changed that into more mixed-use piping from lead, copper, and others. And then in 1962, as you said, they went ahead and banned lead altogether. So for us, the whole issue of this whole movement to remove these pipes is going to probably stay in a limbo kind of state until the administration, the current administration, and the aldermen involved at City Hall get their collective stuff together and start mobilizing with a focus and start implementing plans that are strategic, comprehensive, and sustainable.
Let me just ask, because some skepticism, I know there's some skepticism at City Hall regarding FLAC. Some aldermen and others have expressed to me concern about where FLAC is receiving its resources from. Does your organization have receive any funding or have any other interest than the health of our children?
That has been raised by the Chief of Staff of the Mayor's office. He has made that public, that he feels that our organization is being subsidized by the lead paint industry. He has also made it a point to accuse our organization and myself of receiving dark money. Anybody can punch up the organization's 990s. They can see where we have in our bank balance $185. And that's all we got. And this struggle we have been engaged in has been engaged with a dilapidated laptop and an iPhone. So we don't have the kind of resources the Koch brothers can give organizations to engage in this battle. This battle has been waged on solid science, research, and the intellect of the activists involved.
To go to you, Alderman Zielinski, do you believe that the city should replace all of Milwaukee's lead lines at no cost to homeowners?
I'm in the process of still working with people to address that issue. Where I'm coming from right now is our first priority is to get education out there. Every meeting that I attend.
So that's a no?
At this point in time, I'm in the process of still working with people to identify where we're going to get the funding and how to go about that, as well as a number of other issues.
Oh, to the funding question, can we find the funding for that?
That's one of the things that we're looking at right now, because this is an enormous financial undertaking at this point in time. And this is something that we need to move forward with in terms of a comprehensive plan. And right now, to try and get the entire city on board with the administration and the Common Council and all the other players is going to take a little bit more time. But we do need a comprehensive plan. But our immediate action right now is we've got to educate the public.
You are running for mayor in 2020. There have been a number of things that have come up, around this. Obviously, you're talking about education. The importance of filters was mentioned. If these are the things that are being put forward, what kind of assurances do we have, particularly on the filter front? That future administrations will regard this with a high priority?
Well, obviously, this has not been approached with a sense of urgency. When I introduced my first legislation, working in collaboration with Sherry Tussler from the Hunger Task Force and Robert Miranda from FLAC and other grassroots organizations, we put forth legislation prior to all the information coming out about the problems associated with the health department in terms of families and the questionable notification of kids with elevated blood levels. We've been working on this particular issue before that information came to the forefront. And one of the things that we're most proud of with the legislation that I got approved with the help of Sherry, Robert, and a number of other grassroots activists was that the city no longer promotes the use of flushing as the main means of protecting the public from the effects of lead exposure. Because of the legislation that we got approved about 8 or 9 months ago, the use of water filtration system is the primary means that we're notifying the public in terms of what they can do to protect themselves and their families from the toxic effects of lead exposure.
Well, and some of that public messaging has been changed, but from what I understand, many of the measures put forth in that ordinance have not been complied with on the city level. I want to move to
but if I may just touch upon that very briefly. It's very frustrating for me because when we work on the legislative branch to pass legislation and the administration and the executive branch doesn't follow through, it makes our effort to deal with this particular issue as well as other issues that much more problematic.
Brenda,
yes.
As Dr. Lambrinidou pointed out at that Marquette panel, lead is in fact still used in plumbing that is referred to as lead-free. Lambrinidou said, "We are never going to solve this problem when we keep on producing plumbing fixtures with lead in them. We need to rise up and say no more." Do you agree?
You know, I agree with any and all strategies that are going to reduce the exposure to lead. I don't believe that we'll ever be able to eliminate exposure to lead, but our responsibility and the city's responsibility and public health officials' responsibilities are to reduce that exposure as much as humanly possible. So in any way that we can do that, that needs to be done.
All right, what does that look like? I mean,
well, that looks like, for example, while we wait for these lead laterals to be replaced, that we are make sure that these 70,000 homes that have lead laterals have filters on them. And we need a public health campaign that is robust and up to scale to get this done. So if you have no idea that it's happening, we should really have that robust. The same way that we looked at fire smoke detectors, the same campaign that we used to get that into people's homes, where the fire department went through and I remember as a kid, came to my house and put those smoke detectors in our home. And of course, the thing was, of course, people won't be able to change the batteries. We can it's normal now. People change their batteries. There are days set aside to do that. That's the kind of robust thing that we need until we get those lead laterals replaced. Mm-hmm. And that's where Milwaukee Water Commons focuses on, is getting that information and education out to people up to scale. These little pieces of things that we're doing is not getting us where we need to be.
Earlier this week, the mayor held a press conference implying that lead in water has little to no effect on lead poisoning based on the inability to directly correlate the presence of lead service lines in aldermanic districts with the percentage of children with lead poisoning in those same areas. We heard about it addressed a little bit on the panel beforehand. I spoke with a medical doctor and water scientist recently who said there is no way to tell, unless you look at a particular case, where the source is coming from. Does the city know something that we don't, or are they grasping for straws? And isn't there a difference, considering that water is a city resource delivered through city infrastructure? Sherry, you want to start?
Well, I have a lead service lateral, and when I first tested high, my doctor asked me to find the source of lead in my life, and I looked far and wide. My house is historic, but it had gone through a complete gut rehab, which meant all my interior pipes were plastic, all my fixtures were brand new, I had all new drywall and new paint. I looked at my dishware, I looked at my makeup, I looked at everything I could think of, and in the end, when I started filtering my water, my lead levels went down.
I'd just like to dovetail on what some of the medical doctors made reference to in the previous discussion, and that is lead comes from all areas. It comes from paint, it comes from water, and it comes from the soil. Whether it's 80% from paint, 20% from water, whatever from soil, the point is the toxic effect of the exposure to that lead needs to be addressed, whether it's coming from paint, whether it's coming from water, or whether it comes from the soil. And the previous statements about the negligible effects of water is completely contradictory to the actions that the city's been taking. For example, the city's been providing funding for the replacement of water lead laterals to child daycare centers. We've got a program in place where we subsidize the funding to homeowners when they replace the lead laterals to their house when we're doing work construction. If it's the case that there's no correlation between water, very little, then why is the city engaging in those actions?
So what do you think why what do you think is motivating this?
I can't speculate on behalf of another, individual. The only thing that I can tell you that based on science, it's coming from all those areas, and the city needs to come forward with a holistic approach. We passed, with the help of Sherry and Robert Miranda, we passed 2 major pieces of legislation getting the city to be more proactive in terms of addressing those issues, and from an educational standpoint and from a standpoint of providing help to people that need that help.
Yeah, Robert.
Let me add to this on the whole science side of this stuff. The Centers for Disease Control states in their studies that up to 30% of elevated blood lead levels cannot be immediately tied to the issue of lead paint, soil, and dust. That's up to 30%. Now, here in Milwaukee, we do know that environmental assessments that are done in homes with high blood lead levels, when the health department went to these homes, they never tested for water. So we have no data in this city that can completely give the mayor the conclusive statement that lead paint is the sole source of lead poisoning in our community.
But Robert, isn't it true that the city has the addresses of children who have tested positive for lead poisoning, and that if they were able to release that information, that we would be able to match those
Actually, FLAC
addresses
forced them
up?
to release that address, and that's why those addresses are now on their webpage. However, they have not released blood lead level addresses, and that's the addresses that are important. What we like to know is the addresses where the elevated blood lead levels are, so that way we could take that data and overlap it with the known lead pipe addresses. And then that'll give us an idea, a real strong idea, as to where the high blood lead levels may be linked to the lead pipes. That they don't want to release.
Brenda, do you have anything to
I
add?
think
Can
the
you close us
issue
out
is
here?
really transparency on all our city officials and city governments, and that's the issue. Sit down, let's vet with the stakeholders, let's vet their plans. I imagine they have some plans. We have no idea what they are. Let the community, let the stakeholders vet those plans, weigh in on them, and let's get this situation resolved. It would take about $1 million in our estimation to put on 40,000 filters onto the city of people who cannot afford them. Get that done, get our people safe, and then let's get these lead laterals replaced. And this is not rocket science. This takes will, and this takes community support. Community doesn't care where, the job of the city, of our public health officials, is to eliminate as much as they can, reduce this risk. That is their job.
I'd like to dovetail on those comments very briefly.
That's all the time that we have, everyone. Thank you so much. Appreciate the time and for your willingness to be here. We're going to go back to Susan.
So, Dr. Parody, this has been an hour of information, concern, some strong concern.
Absolutely.
What are you left with at the end of this hour?
Well, really, the only way that we know if somebody has lead in their blood is by testing. So any parent, caregiver, or family of young children, I would really encourage them to ensure that their children are being tested. And if they're not automatically being offered that at their doctor's office, please ask for it.
And any additional thoughts? I mean, we've talked about the importance of, what's heavier in the risk area, paint or water? I mean, how, as a physician, do you assess that for your children?
Well, as I said, Susan, it all comes back to testing because knowledge is power. And until you have the test in hand to know whether possible hazards are affecting health, we don't have a place to start.
Thank you, and thank you to St. Anthony's for its warm hospitality. Thank you to all in attendance, and thank you for those watching at home. We hope you've been able to clear some of the cobwebs over this important issue, and we hope that we pointed you in the right direction when it comes to lead and our health. Another thank you to the United Way of Greater Milwaukee and Waukesha County in partnership with A.O. Smith and Aquasana for providing water filters for our audience members here at St. Anthony's. And thank you to Susan Benz from WUWM, Milwaukee's NPR, and thank you to Jabril Faraj from Milwaukee's Neighborhood News Service. Thank you for being with us and for leading these great panel discussions. Thank you very much for your expertise. And that has been a special edition of 1036, Lead and Our Health, a follow-up. Remember, check out Milwaukee PBS on social media, and please visit our website, milwaukeepbs.org. Goodbye from St. Anthony's School on Milwaukee's South Side.